Pros and cons of Medicare at 60. Changing the age for Medicare eligibility. You know, there's a lot of information out there about this, and I wanted to share with you guys uh, whether it's Medicare for all or lowering the age you qualify for Medicare. There's been many proposals to make Medicare available to more people. Do you know that in 1965, when Medicare became available, only 50% of the population had any kind of coverage? The day Medicare came into effect, 19 million people got coverage. That was quite a feat, when nearly half of older adults had no medical insurance whatsoever. After the baby boom increased, the rate in birth between 46 and 64, the number of people on Medicare continued to rise. Medicare also expanded coverage to people with end-stage retinal disease and certain disabilities in 2007, in 1972. Now, Medicare has been a wonderful product for a lot of people, and we at Insured Meds Senior Health Corp, we help you get through the confusion of Medicare. And all these new things that are happening, you know, about the Medicare for all or Medicaid, and what is Medicaid, and early retirement, and Social Security. You know, right now, Social Security and Medicaid Medicare are out of wink, because if you retire early at 60 and can't get Medicaid, Social Security until 65 or 67, you will have time that you're not covered by Medicare. So you'll be out of sync, and your Social Security check will be out of sync also. Although the Affordable Care Act does not allow a health plan to look at pre-existing conditions, plans can charge older adults as much as 3 times more than younger adults. Medicare at 60 would provide a reasonable option in this case. If you retire before the designated retirement age, you will not receive full Social Security benefits. The earliest age you can receive Social Security is 62 years, but your benefit decreases based on how early you retire. You have to decide if retirement is worth the loss in future income. Now, if you have an employer-sponsored health plan, many people choose to keep working to retirement age to maximize their Social Security benefits, which is a good idea. As many as 61% of people between 60 and 64 years old have health insurance through their employer. Essentially, their employer pays a percentage of the monthly premiums while they pay the rest. So it's not free. There used to be, in the old days, a company would cover your full cost, but not nowadays. This could benefit for several reasons. First, the employer-sponsored insurance would cover more services than traditional Medicare. Second, they have a family member on their insurance plan, a spouse, a dependent, who does not qualify for the health insurance. Medicare covers only one person and cannot be applied to families. However, employer health plans have increased the premiums. Medicare, on the other hand, tends to see more modest rises in premiums over time. Most people get Part A premiums for free because that's what you pay in every month out of your paycheck, while Part B premiums vary based on income. A lot of people don't know, depending on your income, you could pay a higher premium than what in 2021 is $148. In 2021, people in the lowest income bracket only saw a $4 rise in monthly premiums. Also, when there is no rise in Social Security payments in a given year, there's no raise in Medicare premiums. So it's important to be aware of all these little facts as you go forward in your decision making. Medicaid, the uninsured, and the underinsured. Having health insurance does not always mean you can afford to use it. Maybe be expensive deductibles to pay out of pocket before your insurance kicks in. When insurance does pay for services, you can still be left to pay co-pays. A fixed dollar amount for your service, or co-insurance, a percentage of the cost for a service. Not everyone is fortunate enough to afford health insurance. As many as 17% of adults between 60 and 64 are on Medicaid, and 8% are underinsured and uninsured. States with Medicare expansion do not tend to have higher rates for uninsured people. And what is Medicaid? Medicaid is a state-by-state program that coordinates with Medicare to cover your costs of insurance and your drug plan and your deductibles and copays. But unfortunately, if you're getting $1,000 a month Social Security, you don't qualify for Medicaid because the maximum is about $950 a month income for a single person. Unfortunately, many people delay care due to concerns over costs. In 2019, 9.1% of people delayed getting the care they needed, and 8.3% chose not to get care at all. When it came to people who did not have insurance, those rates increased to 32.2% and 30.4% respectively. You know, a lot of studies have gone on to show that people delay going to take care of cancer treatment, lung problems, colonoscopies, all kinds of issues that they run waiting to get to Medicare to be 65 to start getting Medicare. Medicare at 60 sounds promising, but it's also the marketplace to consider. You know, a lot of people come to me when they turn 65, I go to enroll them, and all of a sudden they say, but I was in the marketplace. I didn't have to pay $148 a month. I was only paying $20 a month because of the plans compared to the cost and the options that Medicare gives you from the state government. But marketing and consulting firms compare costs, and in the long run, Medicare is a better program. But you do have to pay that $148 that most people don't know about. In terms of coverage, comprehensive, since Medicare is accepted nationwide as opposed to a state plan. Other options may be limited geographically or by a plan's network. That's another important thing. You know, if you have Medicare, you basically could go to any doctor that accepts Medicare. Now, I offer plans that help you pay the 20% that Medicare doesn't pay. And that's what we offer you, is to help you find which is the company that will give you the best benefits for the lowest cost. Overall, people who have incomes less than 250% of the federal poverty level, approximately $32,000 per year, save more with a silver marketplace plan. Those earning more than 400%, about $52,000 per year, Medicare was the better deal. Don't forget that Medicare has subsidy programs too. The Medicare savings programs can pay down not only Medicare premiums, but deductibles, co-pays, and co-insurance. Anyone who qualifies for one of 4 savings programs also qualifies for extra help, a subsidy program to help pay for prescription drugs. And that's a very important point I want to bring up. There's difference between Medicare savings programs, which helps you pay for the deductibles, copay, and co-insurance, and extra help. Some people, because of their income, only qualify for extra help, which pays a subsidy program to pay for prescription drugs. There are pros and cons to Medicare at 60 that will depend on your income. If the proposal comes to pass, you will have an important choice to make. And that's where we come in. Medicare is quite confusing when you first come into it. And I'm here to help you take away all the confusion and help you get the best plan possible for you. And I want you to reach out to us, Cena Health Corp, and you can text me at 845-380-5809, or go to our Facebook page, Cena Health Corp, on Facebook, or go to our website, cenahealthcorp.com or insuredmeds.com. I'm here for you. I'm here to give you good advice and help you make the best choice for your particular situation. Please like us, share this video, please subscribe to our channel, and spread the word and refer your friends, family, and acquaintances to me, Bill Vargas. I am an independent Medicare agent. I don't work for the insurance companies, I work for you. Thanks again. See you on the next video. Bye-bye.